Hi friends, good day to you all. I am Dr. Ramesh Parimi, surgical oncologist from Pace Hospital, Madhapur. I have been in the field of cancer therapy, including screening and prevention and treatment for the past 35 years, and I have seen a varied number of cases across the big spectrum of cancer diseases. And as you might be aware, the 4th of February every year is celebrated or rather is recognized as a World Cancer Day. The idea being that all of you have to be educated and made aware of the rising incidence of cancer. Now, we all know the causes of various diseases like malaria, we all know mosquito bite, dengue fever, mosquito bite and all that. Similarly, it is not the mosquito bite, but it is the parasite called malarial parasite that enters the blood when it bites a human. But here in case of cancer, it is not because of the infection mostly, it is because of some other causes. So you may be wondering how many cases we do in India and abroad. Globally, there may be about 6 million cases, whereas in India, it's about 1.2 millions. That means 12 lakhs. About 12 lakh new cases are seen every year in India. India's population is about, as you know, 1.5 billions. So you can imagine the magnitude of the problem in India. 12 lakhs of new cases every year, and please note about 1 million, that is 10 lakh patients of cancer die because of the disease. Having said that, grossly, cancer is on the rise. The number of patients we are getting are more and more every year, and also the death rate because of cancer is also on the rise. So what is cancer? The fundamental question is that a useless or functionless multiplication of the cells in a tissue is probably the simplest way to define cancer. When the cells increase in number by means of cell division, it goes astray because there is no control on that. That is apoptosis, it is called, goes haywire. The cells of particular tissue develop and multiply in a crazy way, mad multiplication, leading to abnormal cells. And the multiplied cells without control are not normal. Mind you, they are functionless, they are useless to the individual, or they are foreign to that particular tissue. They differ from the original tissue. For example, the breast cancer cells in the breast are not same as the cells that we find in normal women in the milk ducts. So this is the situation, and this is the genesis of development of cancer in a particular tissue or organ. Having said that, there are causes which are mostly called hereditary or familiar or genetic, where the abnormal genes are transmitted from the parents to the progeny, and the lower down generation, the individual is at risk to develop, because of the aberrant gene or abnormal gene, a particular cancer. So we have got two reasons mainly for development of cancer in an individual. One is hereditary factor, where abnormal genes are transmitted to the progeny from the parents or the ancestors. Secondly, the external carcinogens, which also cause mutation of the genes, leading to cancer development. The external carcinogens, which produce aberrant genes or mutations in the genes, or as I mentioned, smoke, tobacco smoke, deep fried, high red meat, lack of proper antioxidant agents like fruits and vegetables and green leafy vegetables in the diet, which may combat the free radicals that induce carcinogenesis in the cells, especially intestinal tract and respiratory tract. Having said the reasons being twofold, let us see whether there is any control to contain these external antigens. Genetically, yes, probably if the genetic mapping is done, next generation gene mapping it is called, or genetic engineering is taken seriously. The technology shows what are the aberrant genes in the particular individual, and the risk stratification of the individual to develop that particular cancer or the cancer in general can be made out. You can map it out. And prophylactically, treatment may be initiated in one form or other. Whereas in the external carcinogens, it is very easy. Avoid them and probably you escape from developing a cancer. I mean, avoid alcohol, avoid smoking, that is tobacco, avoid exposure to a very spicy and irritating substances like soap and betel nut powder with lime. These things are very irritants and cause. Then there are things like dentures which damage the oral mucosa in the mouth, causing cheek cancer and all that. And there are also, apart from this, infectious agents, interestingly and surprisingly, which cause cancer. And schistosomiasis is a parasitic infection in Egypt and other areas, Middle East, where the parasite develops in the urinary bladder and causes urinary bladder cancer. Whereas viruses, hepatitis B virus for example, hepatitis C virus, they are all prone for not only chronic liver disease but also liver cancer. So viruses like Burkitt's lymphoma virus, which is seen in 3 decades ago prevalently in Africa, the kids developed lymph glands in the neck enlarged. So the Burkitt's lymphoma again caused by a virus. Like there are also Epstein-Barr viruses, then HPV viruses of late, human papilloma viruses which cause cervical cancers in women and also adenoid cancers in both women and men. That's why the vaccination is given at a very early age in the kids, both boys and girls, HPV vaccine. So the viruses and the bacteria rarely, and also very agents, external agents like what I have enumerated, all these agents cause mutant genes to form, and that mutation leads to development of cancer. In order to learn more about early diagnosis, we must know the presentation of cancer. Most cancers are called solid tumors or organ tumors, like solid liver, breast, intestine. They're all called visceral and also bone. They're all called solid tumors. Majority of the tumors are solid tumors, and they present with a kind of lump or swelling in the particular organ that is affected, either bone swelling or breast lump in the breast or intestinal swelling which causes obstruction of the intestine and all those things. Then the kind of ulcer presentation, like gastric cancer can present a small ulcer in the stomach. Mouth cancer also presents like a small ulcer in this cheek or on the floor of the mouth or on the tongue and develops to become a cancerous ulcer. So this is ulcer cancer. So the presentation can be in the form of a lump or a swelling, in the form of an ulcer, or sometimes deep organs like lungs, they present with what you call hematemesis, spitting or coughing out blood in case of lung cancer. Sometimes hematemesis means there is called hemoptysis in lung, whereas hematemesis is pertaining to intestine and stomach especially. So when they vomit blood or the vomit thus contains blood, sometimes there may be bleeding per rectum, that is anus and anal canal, where the stool will be black in color, altered blood. So every cancer has got a set of symptoms which the individual must be alert to notice and consult appropriately and timely. And every cancer has got particular signs. That is what the doctor makes out on examination. So for simply, as we all know, mostly said and done is the breast lump, which may be a dangerous, that is cancer. That's what is to be remembered. At the back of the mind, one should have it, including the patient and the treating doctor, so that we don't miss the diagnosis and timely intervention can be done. Coming to the treatment modalities available for this dreadful or fatal disease is that radiotherapy, surgery and chemotherapy. And solid tumors mostly we treat by surgery, that is knife is the answer. And depending on the stage of the disease, one use can be there that before the definitive treatment, let it be either surgery or radiotherapy, additional treatment also may be given in the form of neoadjuvant therapy, like giving chemotherapy to advanced breast cancer and then operating. So there are different intricacies and details of cancer treatment. More innovative techniques have come into like organ and function preservation in head and neck cancers, organ preservation in breast cancer. So also micro surgeries, that is pinhole surgeries or robotic surgeries in abdominal cancers have come into vogue, and the outcome of these techniques is fantastic, really awesome. The individual gets away by a major operation just in a couple of days or say maximum a week's time after having had this major surgery done with minimal intervention or very small incisions. So various innovative techniques not only in surgery but also in chemotherapy, apart from the conventional orthodox chemotherapy, molecular directed, there is target therapies have come into work, including monoclonal antibodies and also immune checkpoint inhibitors, that is called immunotherapy. Various types of oral chemotherapeutic agents also come into work into the market. We are giving oral therapy for some cancers, like TKI molecules they are called. So various innovations and a lot of research goes into the field of cancer therapy day in and day out. A P number of papers are published about the use of various techniques, mainly especially new molecular agents to control and contain the disease and in some cases to cure it. So immunotherapy is the latest weapon that is present in the armamentarium of the medical oncologists. Radiotherapy techniques, not to say least, do not lag behind. Gone are the days of cobalt therapy, cobalt 60, which used to have a lot of side effects. The new gadgets of radiotherapy, including a linear accelerator, IMRT, IGRT, and true beams, have revolutionized the treatment of tumors using this modality, high energy rays, and the side effects are very minimal, and the tissue damage surrounding the tumor tissue is also very minimal. So these are the various advances happening. Gone are the days when people used to give up on cancer. Now the trend and the emphasis is on prevention, early diagnosis through screening, and the treatment modalities, multimodality, multidisciplinary approach to cure cancer to the maximum possible extent. The last word is about what is called screening. Yes, one can always approach a cancer specialist like me or a cancer institute for evaluating himself or herself, the risk stratification. That is, how much risk do I run to develop a cancer in my lifetime? That's what the contention is nowadays. And the screening and various methods of approach give us an idea into the chances of developing cancer in one's lifetime. Screening is, of course, a periodical, a continuous thing that should happen once in 5 years or 10 years or every second yearly, depending on the situation. High risk individuals and normal risk, all these things are very much tabulated, established screening procedures. This helps us to diagnose cancer early. So prevention, possible to some extent. Screening also possible to a maximum extent, and early diagnosis and cure rates are also possible to a great extent. That's how I put it. So what I would like to suggest is that do not take things for granted that, well, I am immune to cancer. I may not develop cancer at all. I don't have any habits and I may not develop. This is not the thing. Without any so-called specified bad habits, still one may develop cancer. The reason could be manifold or multifold. That's why the awareness is important, and proper preventive measures to be taken, especially healthy diet and healthy weight, and also screening periodically with the appropriate doctor for evaluation of the risk one runs through in his or in her lifetime. So take care of yourselves. I wish you all very good health, free from cancer, on the auspicious occasion of this medical auspicious occasion. It is called Cancer Awareness Day or World Cancer Day.